my job is to treat the breaks that they occur, or treat, hopefully to prevent the breaks. And essentially, the treatment options we have at the present time, most children who are having a significant number of breaks will go on to a medication management, what I call the Sally Field medicine, because Sally Field advertises this bone building medication for old ladies. And they have various forms, and some children are able to take an oral form once they're older, but the very severe ones do also have some problems with their ability to swallow and keep medication safely down and whatnot. And so because of that, the most common medication for children is that of an IV infusion that they take through an IV 3 days in a row every 2 to 4 months. And that way, although the bones are weaker and are still prone to break, you can reduce the number of breaks you have to 1/4 of what it would be if you did not treat them. So 4.5 years ago when I came to the hospital, we started that treatment program, and now our family nurse practitioner, Joni Evans, is in charge of administering that program. And so we get a lot of phone calls to Joni, getting ready for the infusions, to make sure the lab work is okay so they can take the medication, that it's safe to take, and that they're not having side effects from it. Other treatment options that we do are to straighten the bones, because since the bones are very weak and they're constantly being pulled on by your muscles, the bones will have little tiny cracks, and so over a period of time they'll crack, 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 and the bones will eventually start bowing. Ordinarily, our mature bones are somewhat hollow tubes, and the bones, because they've had so many breaks, will often be flat and curved like a ribbon. And so in trying to, and if the natural history for severe children like type 3s and whatnot, they will actually have, their legs will be more of a circle rather than straight legs that will look like we expect people to look like. And so in treating those, we often will end up needing to straighten the bones with a surgical procedure, and then putting a metal rod in the middle of the bone to hold it stable so that they can move around without breaking. And obviously they're children, so those bones need to grow. And although they don't grow as tall as other children do, they do need to grow, and so something needs to be done to help so that as the child grows, that metal stays inside and stays the appropriate length. And so we often have some form of a growing rod that will slide beside each other, or have some method by which the child can grow and still provide protection. But even though we have the growing rods and stuff, they still have to be changed at some point because the children have now outgrown them. You also mentioned the activities they were allowed to do. Once you have strengthened the rod or the bone with the medication, and you have a rod in the middle of the bone won't break, but the end of their bones, their joints, still are very, very fragile. And so although they often will attempt to crawl or walk or participate in play activities, many times that is for a period of time, and they lose some function sometimes because their bones will collapse at the end of the bone, at their knees or particularly, or the ankles. So many of the children, as has been mentioned, will be in wheelchairs that are designed for their size and shape, and they'll be zooming around in their offices. And so even though their legs look straight and they are not having as much pain because they have the rods inside the bone, they still do have some challenges. So basically the treatment is medication early on, surgery once they get to a certain size, and then repeat surgeries depending upon how much they grow, and activities. And then if you have a child who has a broken bone, you try not to put them in cast any more than necessary, because just by putting a cast on, the cast will lead to weakening of the bone. And so we try to cast as little as possible, and we use splints for as long as they're hurting. Someone asked if they had as much pain. as other children that had broken bones. Yes and no. A broken bone hurts like crazy. But because often these breaks are lower velocity, they can break by stumbling over their couch or slipping off their chair. And so that is a lower velocity, so they have less bleeding and less soft tissue damage. And so they may not have as much pain with a specific break, but yes, it still hurts. It's still destructive to their lifestyle. They're very aware of how much discomfort they're in at various times. It's a major factor in their life.
I'm not sure how much you're allowed to speak to this, but could you talk about what kinds of treatments Patrick's received?
I know that he has been at Shriners Hospital and has received some of the expansion rodding.
And I think that's what makes the infusion treatments.
Right.
Is that the medicine you were
Correct.
talking about?
The infusion medications, and he has had that done as well. And it helps markedly reduce the number of breaks you have.
Have you all noticed an improvement since he started? I guess you got both those interventions that improved his number of breaks.
Yeah, I think it did. By the time he 4 or 5 years old, I think it's improved dramatically that he don't need to have any more infusion. And I think there was a stop during 2 years that the number of fractures been decreased, that they even stopped that infusion.
When he was 4 or 5 and stuff? Okay.
The infusions are continued to help reduce the number of fractures, and then sometimes because of the long-term effects of the medication, they will take a drug holiday. And then it's also invasive to your lifestyle, and so you're trying to avoid that. And then may go back at a later date. Also, with age comes wisdom, and you no longer try some things that you would try when you're younger. And so typically, the number of fractures tend to decline just because you get more concerned about what you're doing, be willing to do to break your bone, but then also with the age and size.
How many patients have you seen, I guess, with this condition?
Currently, I think we have 8 patients here in Chattanooga or Chattanooga area who are currently receiving the infusions. I don't. Just trying to keep track of, is it 6 or 8? They're currently getting the infusions because of holidays or, whatever.
How rare is it? It seems not common, but not extremely rare. If there are 8.
Somewhere between 2 and 5 and 100,000 or something like that.
1 in 15 to 1 in 20,000. Okay.
Yeah, that works out right. Yeah.
So is that a fair assessment? Not common, but not on the extreme end of rare. In terms of genetic diseases, it's common. Okay, in terms of genetic,
because of the number of breaks and because of the medication and because of other things like that, they are frequent flyers at a children's hospital. I operated for 6 hours yesterday on one. It's one of the things we do.
Any other questions? Yes. Would you be able to give a couple examples of, I guess Dr. Ho maybe can speak to this, of situations where Patrick broke a bone, where not really doing anything you would think would normally break a bone?
Yeah, I think the most you mentioned, the older he gets, more mature, he be aware of what he can do, what he cannot do. But again, the father is very protective of Patrick, and he constantly holding Patrick and learn how to pick up Patrick and lay him down. He would put shoes on Patrick himself instead of let Patrick do it. So those things that he's been learning all along for the last 9 years help him to decrease the fracture. And as I mentioned earlier, sometimes they fix the fracture themselves.
They'll put a splint
They put
on
his own spring that they saved from the last time. And they say as long as Patrick is not in pain, then they do it themselves. So they learn how to deal with those numerous fractures that he has.
And when he was young, you mentioned, I think,
Yeah, it does. Fall, and I think he was even admitting at Erlanger when he's around years old for skull fracture. Because
Skull fracture.
just slip over.
Children have broken their bones just lifting them in and out of the carrier, a car carrier.
Changing a diaper.
Yeah, changing a diaper, lifting it out of a car carrier, giving them a bath.
Must be hard for the parents. Stressful all the time.
Dr. Halsell, about how often do you see Patrick now?
I see him probably once or twice a year. As I mentioned, whenever we have fracture, either he go direct to the ER or the parent should fix the fracture themselves.